Hi, I'm Mary Ackerley, an integrative psychiatrist who's been using oxytocin for more than 5 years in my practice. Oxytocin has been called a biological metaphor for safety, and in my experience, using it can be very helpful for many who are working to regulate their nervous system. But it does a lot more for the body, and today I want to explore its astonishing range of important physical and neuropsychiatric benefits. So most of us know that oxytocin is synthesized in the hypothalamus and then stored and released from the posterior pituitary gland into the bloodstream. But recently, oxytocin has also been found to produced and secreted in the gut, specifically by the enterocytes in the intestinal epithelium, and that Lactobacillus reuteri can stimulate its release. I will address later how to optimize Lactobacillus reuteri at the end of this lecture. Interestingly, oxytocin is also produced and released by the heart, acting on cardiac receptors to decrease heart rate and the force of cardiac contraction. So oxytocin is quite versatile and it functions as a peptide. It's a small molecule composed of a chain of amino acids, which makes it a peptide. It's a neuropeptide also, meaning it's synthesized and used by neurons, acting as a signaling molecule within the brain and nervous system. And it's also a hormone, meaning it's released into the bloodstream and acts on distant tissues, influencing physiological processes like milk ejection and uterine contractions. For simplicity's sake, I refer to it as a peptide throughout this lecture. There are many benefits of oxytocin. The neuropsychiatric includes social bonding, emotional well-being, resilience, deep sleep, and it's now emerging as neuroprotective for the brain. Physical anti-inflammatory benefits include strengthening bone and promoting growth. It's a mast cell stabilizer. It improves GI permeability and inflammation. It increases muscle mass. It's a metabolic GLP-1 agonist like semaglutide, but milder. Reproductive benefits include libido. And in the cardiovascular system, it's been shown to promote stem cell growth, perhaps helping repair. So these are the major benefits I see every day in my practice. Sleep, it improves deep sleep, which is of course enormously beneficial for health. It optimizes vagal tone, improving anxiety, depression, and resilience. It's helpful for tapering patients off benzodiazepines and SSRIs. In the brain, it improves cognition and focus. It increases hippocampal gray matter and decreases tau and amyloid beta plaque, which are major benefits for our aging population. Libido, both men and women, but especially postmenopausal women, benefit from this oxytocin benefit. Bone strength, again, a huge benefit, especially for postmenopausal women. And it decreases urinary frequency by increasing ADH, which makes it very useful in the mold population. So to get you interested, here are some comments from my patients, which may give you an idea of how helpful this peptide is in clinical practice. Changed my life. Multiple patients, up to a third of the patients taking oxytocin, have told me this. Now, a clinical response this strong got me to really pay attention to investigating what oxytocin was doing. I started off prescribing oxytocin years ago to mold patients to increase their antidiuretic hormone. And I can tell you that prescribing DDAVP, a drug which also increases antidiuretic hormone, never got this kind of a positive response. I got off my benzos. That's someone who was on 3 milligrams daily for 9 years, which is a very high dosage. I stopped taking my SSRIs and never noticed the difference. I sleep through the night. I don't get up anymore at night to urinate. This is a really common response. My neuropathy doesn't bother me anymore. My mental life and love life are great, and my husband is really grateful to you also. I definitely hear that quite often, usually with a little smile. My sleep is great, and I don't even worry anymore about sleep, which is big because that anxiety about going to sleep can be very big for a lot of people. The brain fog is gone, and my energy is better. That's a long COVID patient, and I'll talk about that later. It's a lot easier to deal with my family. Again, this is fairly common, although you may have to point it out to people when they tell you things and you realize, wow, they're getting along better with their parents or they're socializing more in school, etc. It puts a bonum in how low my moods go. And again, for someone who's dealt with depression most of their life, that's quite beneficial. I don't feel the need to tell every driver around me what a lousy driver they are. And this was the comment made many years ago by a mold patient who was taking it for frequent urination that got me really wondering what else oxytocin was doing. And this is my favorite from an 83-year-old female who's been taking oxytocin for several years. I noticed I got out of hip rehab much faster than my friends. Now, may not seem like much when you're 40, but when you're in your 80s and your friends are going into hip rehab and not actually getting out, it's very significant. So let's explore these benefits in more depth. Deep sleep. Studies have shown that oxytocin can increase sleep duration and improve sleep quality. It promotes relaxation and reduces stress, which can facilitate sleep. Oxytocin may also help regulate breathing patterns during sleep, reducing sleep apnea episodes. That's not well known, but may be useful for some of your patients. And the proposed mechanisms of action are oxytocin binds to receptors in the brain, particularly the hypothalamus and brainstem, which are involved in sleep regulation. It stimulates the release of other sleep-promoting chemicals, such as serotonin and melatonin, which is very helpful. And it also inhibits the release of stress hormones, such as cortisol, which can interfere with sleep. That ability to reduce cortisol, again, is quite useful, and we'll talk about that later. So the ability to improve vagal tone is a major feature of how oxytocin works. In practice, you see it promotes feelings of trust bonding and social connection in all mammals, including these cute kittens. It enhances empathy, generosity, and kindness, and boy, could the world use a little more of that right now. It reduces stress and anxiety, and it improves mood and overall well-being. And this is a benefit most people taking oxytocin will notice. Clinically, this is really useful because the enhanced vagal tone facilitates the tapering off medications like benzodiazepines and SSRIs, reducing withdrawal symptoms and promoting well-being. And it's something I use quite frequently in my practice for this reason. So oxytocin unfortunately declines with age, and as individuals age, oxytocin production decreases, adversely affecting stress regulation and increasing vulnerability to age-related diseases, including cognitive decline. My major point here is estrogen increases oxytocin, and after menopause then, as estrogen dramatically decreases, so will oxytocin. Also note that a drop in estrogen or magnesium can trigger a drop in oxytocin, which may play a role in migraines. In practice, I've seen oxytocin help migraines. Let's look at oxytocin's multifaceted roles in promoting neuronal health, particularly in relation to aging, neurodegeneration, and cognitive function. Oxytocin is protective of the blood-brain barrier. One mechanism includes binding to RAGE receptors, which is profoundly anti-inflammatory. Just look at the diseases RAGE is linked to: diabetes, atherosclerosis, cancer, metastases, pulmonary fibrosis, etc. And in my opinion, this may be one of the mechanisms which makes it so useful in treating mold brain. Glial cells are really important. They are the brain's macrophages and underlie neuroinflammation. And interestingly, they also modulate the release of oxytocin. Since most of my mast cell mold patients have sea of blue neuroinflammation on their neuroquants, this research implies oxytocin can be useful in the treatment of mold brain neuroinflammation. And in practice, I see this to be true. Now, this is pretty interesting. Oxytocin may help counteract Alzheimer's by reducing amyloid beta toxicity and tau, key factors in the disease's progression. Given our ongoing epidemic of Alzheimer's, I feel this is reason enough to prescribe for those with family histories of Alzheimer's genetics. Patients comment that they feel it noticeably improves brain fog and short-term memory, and recent research supports these observations. In fact, increased oxytocin levels are linked to improved results in memory assessments, suggesting therapeutic potential for cognitive impairments. And studies show that oxytocin may significantly enhance memory performance in various tasks, indicating its role in supporting cognitive abilities. Oxytocin increases gray matter through the proliferation of neural progenitor cells in the hippocampus. And remember, the ultimate brain injury in Alzheimer's is destruction of the emotional memory center, the hippocampus. And this may be new information for many. Oxytocin may be helpful in stroke prevention and recovery. Oxytocin promotes neuronal survival and repair, which could be crucial for stroke recovery strategies. Oxytocin is shown to aid recovery following ischemic strokes by protecting against neuronal damage and enhancing functional outcomes. The neuroprotective effects of oxytocin appear to be mediated by its anti-inflammatory properties, inhibition of neuroinflammation, activation of several antioxidant enzymes, inhibition of oxidative stress and free radical formation, activation of free radical scavengers, and prevention of mitochondrial dysfunction. Again, oxytocin promotes the growth of new neurons in the hippocampus. I don't think I can say this too often. This supports memory and learning, and increased neurogenesis may help counteract declines in cognitive function associated with aging. Again, another major point of this talk. Oxytocin is profoundly anti-inflammatory, and that alone may help many chronic diseases of aging, such as Alzheimer's, Parkinson's, mold, and osteoarthritis. Oxytocin enhances the production of antioxidant enzymes, supporting neuronal integrity by combating oxidative stress and reducing cellular damage. With neurotransmitters, oxytocin helps maintain an important balance between excitatory and inhibitory neurotransmitters, crucial for optimal brain function. So to summarize, oxytocin for the brain enhances cognitive function, stimulates neurogenesis, balances neurotransmitters, has anti-inflammatory effects, reduces oxidative stress, improves memory performance. It has potential as a possible treatment for Alzheimer's, and supports age-related cognitive decline and stroke recovery. If it only did this would be a miracle, but it does a whole lot more. So let's talk briefly about COVID vaccination and oxytocin. This very recently released, well-documented study of more than 9 million Italians found significant increases in neuropsychiatric disorders, including stroke, Alzheimer's, depression, anxiety, and sleep disorders, following both COVID and COVID vaccination. Another very recent review of 85 million vaccinated and unvaccinated found quite elevated risks of stroke, heart attack, coronary artery disease, and arrhythmias following vaccination. This Korean study took a random sampling of the over 65 population, compared vaccinated with unvaccinated, and found a significantly higher incidence of moderate cognitive impairments and Alzheimer's in the vaccinated. And this systemic review of the literature, also from Korea, showed significant increases in anxiety and sleep disturbances, although not depression, following vaccination. Other studies have shown significant increases in psychosis, sleep, and anxiety following COVID infection. So, can you see how helpful oxytocin might be for these neuropsychiatric disorders following both COVID infection and COVID vaccination? And in my clinical practice, it is one of the first treatments I reach for in long COVID and post-vaccination, and it seems very helpful according to patient reports. What you say? There's more benefits? Just think for a moment. How does nature allow women to recover from the birth experience quickly enough to start wanting to care for that bundle of joy and keep it alive after all the pain it just caused her? It's oxytocin, and when you think of its role in birth, you can understand how powerful its effects are throughout the body. Pain reduction is a well-documented benefit multiple patients have noted. Lowering cortisol can be difficult, and oxytocin does help through modulation of the autonomic nervous system. And again, you're going to hear me say this many times, oxytocin is profoundly anti-inflammatory. It can increase glutathione and decrease inflammatory cell infiltration in colitis. Oxytocin has been shown to stabilize GI mast cells. And how useful might this be for mast cell GI disorders, which can be profoundly disabling, such as colitis or irritable bowel? Now, oxytocin treatment improves cardiac work, reduces apoptosis and inflammation, and increases vascular scar repair. It can be very useful for POTS, which is often associated with mast cell. By reducing urinary frequency, it makes it easier to maintain vascular volume, which leads to a decreased need for compression stockings and daily electrolyte fluids. Recent research suggests that oxytocin increases the production of cardiac stem cells and heart regeneration. Think for a second how useful that could be for the myocarditis and cardiac damage after MI mentioned on slide 25, which all of us are seeing in increased numbers since COVID and vaccination. The mast cell stabilization properties of oxytocin are very helpful for the majority of my patient population. And oxytocin is a mast cell stabilizer for cardiac cells. This makes it possibly useful for Kuhn syndrome, which is an acute coronary syndrome characterized by mast cell activation, and Takotsubo cardiomyopathy, also known as broken heart syndrome, which is a sudden and acute form of heart failure that occurs when the heart muscle suddenly weakens. New research shows oxytocin can facilitate natural bone formation and has no effect on bone reabsorption. And as we shall see, it does that with a lot less side effects than Fosamax. Again, this is very important research on bone growth. Statistically, I think almost as many women die from hip fractures each year, almost twice as many women die from hip fractures each year versus breast cancer. So osteoporosis essentially is one of the leading causes of death in older postmenopausal women, and many find the current pharmacological solutions unsatisfactory. The oxytocin story gets even better. I want to really highlight this suggestion that oxytocin is helpful in breast cancer. And for that reason alone, I think every menopausal woman on bioidentical hormone replacement should also be on oxytocin. And if working with a breast cancer patient, consider using it for sleep and anxiety because of its safety profile. So, research shows that oxytocin increases lipolysis and reduces fat mass, including visceral fat deposits. It helps impaired leptin signaling, which is noted to be quite impaired in many mold patients, and can promote weight loss. It may help increase muscle mass and lower LDL, which is a difficult thing to do. It increases fat utilization and reduces waist circumference. Oxytocin improves muscle mass in sarcopenic adults. Realize this is very helpful for aging adults. And oxytocin is a mild GLP-1 agonist like semaglutide, and some people notice a reduction in hunger, especially when using the yogurt form of oxytocin, which I will discuss soon. And here's why we should all be taking oxytocin. It may help wrinkles. Oxytocin definitely helps with collagen production and skin elasticity, and may also help with cartilage matrix destruction. This is not a minor benefit for people who are aging with poor wound healing. And a study did find that people with higher levels of oxytocin had more youthful looking skin. And in practice, that's one of the benefits that's easily notable and keeps people wanting to use this for a long time. I would hope it would be their brains and bones, but in general, people are very motivated by how their skin looks. So there are multiple benefits in using oxytocin for the EDS/hypermobility patient population, which is a large part of my patient population. In my experience, this group of patients is most likely to call oxytocin a miracle. It decreases amygdala activation through improving vagal tone. It facilitates limbic stabilization in those who have sympathetic hypervigilance. It strengthens collagen, which is really needed. It improves hydration, helping POTS, and it's a mast cell stabilizer. So I think Given what we know about the trifecta patient, you can see why this is potentially very useful um, for people with hypermobility. Now, oxytocin can increase testosterone levels, and this may contribute to the improvement in libido seen in both men and women. Let's talk about dosing. Most research studies have been done with just 24 international units delivered intranasally twice a day. Sometimes just one dose was enough to show benefits in these research studies, which again should give you some indication of how powerful oxytocin is. Now, only very small amounts of peripherally circulating oxytocin are thought to cross the blood-brain barrier owing to an endothelial barrier with tight junctions, which is a presumptive assumption in the mast cell mold population. However, this recent experiment clearly shows oral administration using lollipops produces similar improvements on intention and anxiety. And this has been my experience also, that oral dosing as troches or controlled release tabs is effective. And this is a really important study to remember when deciding how to administer oxytocin to your patient. Oxytocin is rapidly metabolized. Its half-life in blood is about 5 minutes, and in cerebral spinal fluid around 20 minutes in humans and in rats. Therefore, many of the effects of oxytocin seem to be through modulation of the autonomic nervous system, leading to improved cardiovascular and inflammatory response, as well as increased vascularization and cerebral blood flow. And oxytocin's ability to modulate the autonomic nervous system may make it a key player in helping patients with chronic complex illness with trauma recover more easily. So this is who I suggest prescribing for. Mold patients with frequent urination, male and female. It's easy for patients to measure the benefits in terms of decreased nightly trips to the bathroom. This usually works within a week or two. Probably all peri and postmenopausal women, but especially those with brain inflammation, the sea of blue, mast cell, hypermobile EDS patients with POTS and mast cell, as discussed previously. Mold, anxiety, and insomnia. And I'll just put it as a side because for many years I talked about VIP and how useful it is. I've found overall oxytocin is more beneficial for most, although VIP has a place, but a much smaller place in my practice. Long COVID and post-vax, especially with neuroinflammation, osteoporosis, absolutely. Sarcopenia, chronic pain. And again, when people are in pain and doctors are not prescribing narcotics anymore, you're going to find oxytocin actually can reduce pain probably 30 to 40%. Myocarditis, now it's a big one since we don't have a lot of treatments there to repair the scarring of the heart. And PTSD trauma patients, especially who are in concurrent brain retraining, it's a total winner with people who are working on brain retraining and doing vagal tone exercises, and they are most likely to notice its benefits as they do their exercises. So this is how I am using oxytocin. I use oral as a sublingual troche or controlled release tablet. The compliance drops dramatically with intranasal that needs to be refrigerated or sub-Q daily dosing. And in my experience, it's not more efficacious over the long run. I start at 80 international units for most now. That's usually enough to decrease urinary frequency. Higher dosing seems to be better for modulating the trauma response and helping with neuropsychiatric issues. In patients, usually postmenopausal with known PTSD, I've found dosing 100 BID to increase resiliency, improve sleep, including nightmares, and decrease hypervigilance with no noted side effects. Many local pharmacies will make troches or make sublingual drops. Now, oxytocin is really safe compared to most pharmaceuticals, even supplements. It's FDA approved for cardiovascular and renal disease, making it quite safe in people with these issues, as well as eclampsia, preeclampsia, and premature rupture of membranes. Two side effects are important to remember. it may be associated with cancer. That I believe is correlation, not causation. And given how anti-inflammatory oxytocin is, I feel higher levels of oxytocin seen in prostate cancer probably reflect the body's attempt to reduce prostate inflammation. And recently, I've had at least 2 men with high prostate numbers bring them down significantly using oxytocin, which tends to support my theory. In settings of danger, oxytocin can function like vasopressin and increase fear signaling. However, I got to tell you, in mold, no one has antidiuretic hormones, so a little stimulation may actually be helping the observed decrease in urinary frequency. And very rarely, patients may notice increased nightmares and anxiety. Stopping further administration quickly resolves that side effect. I warn patients who are in extreme hypervigilance if they notice oxytocin is increasing irritability or anxiety. We're simply learning that they're essentially showing they do not perceive their current environment as safe. Taking it in the day, cutting doses by 3/4, or waiting until the stress passes usually helps. I do not recommend starting it in a strange place like a hotel, campground, etc. Here are the most common side effects I see. It's menstrual cycle dysregulation, especially in perimenopausal mold patients who are already dysregulated. Usually resolves within 3 months, rarely a reason to stop, especially if you've warned the patient. There are idiosyncratic mast cell reactions such as a rash. Can try another formulation, including nasal spray, and they usually resolve. And then increased anxiety, as previously explained, I tend to stop until the patient is in a more stable setting. In my practice, there's probably about 2% who we just are not able to use oxytocin. As a reminder, low-dose naltrexone is also a glial modulator. I use low-dose naltrexone very frequently in my practice for glial modulation of neuroinflammation, recovering from long-haul whatever, pain and neuropathy. I believe adding oxytocin is synergistic with no known interactions. And just quickly, my protocol for using low-dose naltrexone to decrease microglial activation is I usually start at 1.5 and increase slowly to 4.5. Sensitive patients can start at 0.25 and increase to 0.75. It's primarily needed for patients with tick-borne infections in their brain. Should be tried in most mast cell patients because it is a mast cell stabilizer, and combining it with lipoic acid, 300 milligrams BID, really helps neuropathy. And that fact doesn't seem to be well known. And now, as promised, Lactobacillus reuteri has been demonstrated to improve the secretion of oxytocin in the gut. Directions for making oxytocin yogurt can be found in Dr. William Davis's book Supergut or on my website blog. The benefits noted in patients tend to be more GI, such as decreased bloating and reactivity, improved digestion and regularity. Most notice some improvement in muscle mass if they are exercising, and sleep. I think the troche tablets and higher dosing are needed for the neuropsychiatric benefits, such as detoxing someone from Klonopin, but I encourage everyone to add the coconut version of the yogurt to the healing regimen. It's really fun to make. It's very tasty. And I think anything that can help the gut at a low cost should be added to your health regimen. Here are some useful citations. Now, I encourage you to do quick searches every time you have a clinical problem to solve to see if oxytocin might benefit your patient. You'll be surprised how much research there is, which, as far as I can tell, is not being applied clinically except in the psychiatric population. For instance, yesterday I saw a young woman with petit and grand mal seizures. A quick search showed that its use was quite promising in rats in controlling grand mal seizures. I'm quite curious to see if it helps, and the patient was quite willing to try it. So thank you for listening. I hope my research and experience encourages others to explore the benefits of oxytocin.